Hello everyone, welcome to Community Medicine Insight. In today's video, we will discuss one of the most important topics in child health, that is infant and young child feeding, commonly known as IYCF, along with complementary feeding. In this video, we will discuss about the initiation of breastfeeding, what is exclusive breastfeeding, what are the common problems which are encountered during breastfeeding like sore nipples, mastitis, engorged breast, details of complementary feeding, what foods to include, what to avoid, what should be the consistency of food. Along with that, what is the importance of hygienic practices in making the food of the baby and how to feed a sick child. There are 5 golden rules for infant and young child nutrition. First is we have to start breastfeeding within 1 hour of birth. Second, during exclusive breastfeeding, we have to give only breast milk, nothing else. Third is the initiation of complementary feeding after the completion of 6 months. Fourth is to ensure diet diversity during feeding the child. And fifth is maintaining hygiene during feeding. We will go through details of each point one by one in the upcoming slides. If these 5 practices are followed properly, they can significantly reduce the burden of malnutrition, infections, and ultimately infant mortality. The first and most important step is the early initiation of breastfeeding, and the breastfeeding should be started within the 1 hour of birth. The newborn must receive colostrum, which is the thick yellow first milk produced by the mother. And this colostrum is rich in immunoglobulin, various antibodies, and WBCs and vitamin A. It protects the newborn from diarrhea, pneumonia, and sepsis. In some communities, it has been seen that they discard this colostrum, which is very important for the baby's immunity. So all these things are known as prelacteal. Anything which is given before the breastfeeding is known as a prelacteal, and no prelacteal feed should be given to the baby as it can significantly increase the risk of various infections. And secondly, it also interferes with the breastfeeding establishment in the baby. Breastfeeding benefits both the baby as well as the mother. For baby, it provides immunity, reduces the chances of infection. It provides warmth to the baby that helps in the maintenance of temperature and reduces the risk of hypothermia in newborns and better cognitive development. While in mother, it helps in the uterine contraction and decreased postpartum bleeding. How breastfeeding reduces the chances of postpartum hemorrhage? So during the breastfeeding, when the baby suckles at the breast, it stimulates the receptor in the nipple that sends signal to the brain, and particularly hypothalamus and the posterior pituitary gland. In response to that, the oxytocin hormone is released. This oxytocin causes the contraction of smooth muscles of uterus, that is myometrium, and that leads to the compression of blood vessels and thus reducing the bleeding and chances of postpartum hemorrhage. Other advantages of breastfeeding to the mother includes the decreased chances of breast and ovarian cancer and promotion of bonding with the newborn. Many mothers think that breastfeeding cannot be started after the C-section delivery, but that is incorrect. So if the spinal anesthesia is used, the breastfeeding can be started within 1 hour, And if the general anesthesia is used, breastfeeding should begin once the mother regains the consciousness and is stable. Now let us discuss exclusive breastfeeding. That means the baby receives only breast milk for first 6 months and nothing else. No water, honey, animal milk, good tea, juice or any formula milk. Mother's milk contains all the necessary nutrients which are required for the child, and even during summer season, the breast milk alone is sufficient as it contains adequate amount of water. And the child should be breastfed on demand in day as well as in night. Now we will discuss some common breastfeeding problems one by one. First is the perception of milk insufficiency. So one of the commonest reason mothers stop breastfeeding is the feeling that my milk is not sufficient enough, and they start with either bottle feeding or some animal milk to the baby. But true milk insufficiency is actually uncommon. First is the delayed initiation of breastfeeding. Breastfeeding should be ideally be started within the first hour after birth, as we have read in the earlier slide. So early initiation that stimulates the milk production, because as the baby suckles, that releases the hormone prolactin and oxytocin. So when the breastfeeding is delayed, that stimulation is reduced. And due to this, the milk production may also become decreased and the mother may feel that they are not producing enough milk. So early initiation helps in the baby receiving the colostrum and also the production of milk. Other reason is infrequent feeding. The breast milk production that works on the principle of demand and supply. The more frequently baby suckles, the more is the milk production. So if the feeding are infrequent or there are long gaps between the feeds, the breasts are not emptied regularly. So this will ultimately decrease the milk production. And this can create a false perception of milk insufficiency. Next is not enough time per breastfeed for baby to complete the withdrawal of breast milk. What happens? Many mothers stop feeding too early because either the baby becomes quiet or sleepy. So in the beginning, when the baby is feeding, the baby mainly receives fore milk, which is watery and helps in satisfying the thirst of the baby. And as the feeding continues, the baby receives the hind milk, which is the later part of the milk, which is rich in fat and provides satiety and helps in weight gain. So if the breast is not emptied adequately, the baby thirst may be satisfied but not the hunger. And the baby may cry again soon after the feeding and leading the mother to think that her milk is insufficient. So mother should allow baby to feed properly from one breast until the breast becomes softer or baby leaves the breast naturally. When the water, honey or animal milk or formula feeds are given unnecessarily, the baby suckles less at the breast. So decreased suckling leads to decreased stimulation for milk production. Incorrect position and attachment. So this is very important point. Whenever mother is saying that there is insufficient milk production, we have to see the position and correct latching. Mother may complain that I am feeding the baby for 30 minutes, 45 minutes and my milk is not sufficient, that's why the baby is hungry. So we have to see that the position is correct or not, because if the position is not correct, in spite of feeding the baby for 45 minutes, the effective milk transfer will not be there and baby will be hungry all the time. A mother's emotional and physical condition also affect the breastfeeding. Stress, anxiety, fear, pain, exhaustion, all these can interfere with the oxytocin reflex, which is responsible for the milk ejection. So even when the milk is produced, it may not flow properly if the mother is anxious or tired. Lack of family support, sleep deprivation, pressure from the relatives. So all these conditions can also further worsen the situation. So what we have to do in such situation? Reassurance, counseling, adequate rest to the mother, emotional support are very important for successful breastfeeding. How do we know that the baby is receiving adequate milk? First is, if the baby is passing urine 6 or more times, it means the baby is getting sufficient breast milk. There should be adequate weight gain. If the baby sleeps well between the feet, that also indicate that baby is getting enough milk. So if the mother is complaining of milk insufficiency, we have to see all the factors which we have studied in the last slide, and we also have to look upon the baby, that the baby is gaining weight, the baby is passing urine 6 or more times or not, and is the baby sleeping between the feet or not, and we have to counsel the mother. Another common breastfeeding problem includes engorged breasts. This happens due to milk accumulation. Its causes include delayed initiation of breastfeeding, either the baby is not attached proper, poor latching, infrequent feeding, or restricted duration of feeding. So here the milk is produced, but since the breasts are not being emptied from time to time, the milk accumulation occurs. How to manage engorged breast? The management includes frequent feeding and proper attachment and emptying the breast regularly. To assess the proper attachment, remember the word calm. It means the chin should be touching the breast. So this is the correct technique, this is the incorrect technique. More areola should be seen above the breast and less below the breast. So this is more areola is visible here. Lower lip is turned outwards and mouth is wide open. So this is the case. Here the baby is sucking only the nipple. So what will happen? There will be no effective transfer of milk even if the mother is feeding for a longer duration of time, and here milk accumulation can occur. Next is sore or cracked nipple. In sore nipple, there is pain and tenderness of the nipple. In cracked nipple, there is a break in the skin of the nipple which may bleed, and it's very painful also. It is mainly caused by the poor attachment at the breast. What is the management here? What to do? Encourage and support the mother for proper attachment, as we have read in the earlier slide. Continue breastfeeding. Advise applying few drops of breast milk, particularly hind milks, on nipple after feeding and let it air dry. Next is mastitis. Mastitis is the inflammation of breast tissue which is due to the milk stasis and infection. Its clinical features include pain, redness, warmth. The patient may also have fever or ill-defined lump. Infection typically occurs in one breast only and can be recognized by the presence of well-defined red heart or swollen area over the breast. How to manage this condition? That encourage the mother and support frequent breastfeeding, or if the mother is not able to breastfeed, expression of milk is to be done to increase the milk flow. Milk drainage helps in recovery. Therefore, breastfeeding is advised. If the mother has fever and it is not improving in 2 days, then mother should seek medical treatment and may require antibiotic. So the important management is here that the mother can continue breastfeeding from both the breast even if she is having antibiotics. So after reading about exclusive breastfeeding and the management of common breastfeeding problems, now we will move on to the significance of complementary feeding. After 6 months, the breast milk alone becomes insufficient to meet the child increasing nutritional requirement. And at 6 months of age, the child is developmentally, physiologically also ready to accept the other food. So there is an energy gap, as you can see. From 6 to 11 months, the breast milk provides more than 50% of the energy need. From 12 to 24 months, the energy gap increases and the breast milk provides only the 30% of the child energy needs. So after 6 months, the children should be introduced to age appropriate, nutritious and safe complementary food along with continued breastfeeding. If the complementary feeding is delayed, it can lead to growth faltering in the child. It can also lead to micronutrient deficiency and malnutrition. So the complementary food which we are providing, that should be adequate. Adequate means the food should provide sufficient energy, protein and the micronutrient to the growing child nutritional needs. We have to make this food energy dense because their stomach capacity is very small. So we have to make this food energy dense by adding sugar or jaggery, ghee, butter or oil. Provide more calories from the smaller volume. We have to make the consistency thick. And iron fortified foods, iodized salt, vitamin A enriched food should be encouraged. A common mistake which we usually see in our OPDs or in the community settings, that the mothers give watery food like either the diluted dal water or rice water. So the complementary food should not be watery or liquid. How to check the consistency? That the food should be thick enough to stay on the spoon. If the food is very watery, it will not provide sufficient energy. The consistency will vary as per the age of the child. So at 6 months of age, we can give mashed food and it should be small pieces by 9 to 10 months, and by 12 months we can give soft adult foods that can be easily chewed and swallowed by a young child. Introduction of lumpy or granular food should be done by the age of 9 to 10 months. So use of mixer, grinder to make the semi-solid paste, it should be discouraged. Delayed introduction of textured food may cause feeding difficulties later. This table shows the kind of food which we can give from 6 months to 9 months, 9 months to 12 months, 1 to 2 years and 2 years to 5 years. So these are the examples what can be given to the baby, and we have to increase the frequency as the child age increases. You can see here we are starting with 2 to 3 spoons and gradually increasing the amount of food which we are giving to the baby. The frequency is also very important. We have to continuously increasing the frequency. Apart from 3 or 4 main meals to the baby, we have to give 1 to 2 snacks. Consistency has to be kept according to the age of the baby. At 6 to 9 months, we can give mashed, thick consistency that stays on spoon, as we have seen in the earlier slide. At 9 to 12 months, we can provide mashed, finely chopped, some chewable items that a child can hold. From 1 to 2 years, mashed, chopped, some items a child can hold. At 2 years, we can give whatever the family is eating and how much the child wants. Up till now, we have learned the importance of complementary feeding, what should be the consistency, how many times it should be given. Now, what are the foods which we have to avoid? Avoid giving biscuit, sugar, salty packets of snacks to the child. Avoid giving water or breastfeeding before meals. This point is important because if we are giving water or breast milk to the baby before feeding, then as we know that stomach capacity is very small, the stomach will be filled by the fluids only and the baby will not like to eat food. Foods which can pose choking hazards are to be avoided, and force feeding should not be done. Threatening or punishing the child if the child is not eating properly should be avoided. One of the most important concept is the dietary diversity. So these are the different food groups. These include cereals, fruits, tubers, other fruits and vegetables, vitamin A rich fruit, milk and milk products, eggs, meat, pulses and legumes. So a child should consume at least 4 out of 7 food groups regularly. And this will ensure that the child is getting adequate proteins, vitamins, minerals and the micronutrient. Taking a diverse diet is very important for the child as diet diversity supports brain development. It helps in building immunity, helps in growth of the child and also helps in disease prevention. Coming to the last part of the video, that is the hygienic practices. They play a very important role in the infant and child young feeding. Unsafe feeding practices, they increase the chances of diarrhea and infection. So washing caregivers and children hands before food preparation and eating is very important. Storing food safely and serving foods immediately after preparation is also necessary to avoid any contamination. And using clean utensils to prepare and serve food. And use clean utensils to prepare and serve food. Apart from safe food storage, the use of clean cups and bowls when feeding the child is also important. Many caregivers, they reduce the feeding during sickness. So during illness, the feeding should continue. The child should be fed according to his or her wish. Feed the child several times and in small quantities. When the child is recovering from illness, increase the food intake so that the child regains his or her weight. This is known as a catch-up feeding. During illness also, washing hands with soap before cooking or feeding and after cleaning the feces of the child is very important. The Government of India has launched several programs to improve the infant and young child feeding practices and to reduce the malnutrition among children. For the promotion of breastfeeding practices, there is a MA program, that is Mother's Absolute Affection. This program mainly focuses on the promotion of breastfeeding, provides counseling and support to mothers for the early initiation of breastfeeding and proper complementary feeding. Village Health Sanitation and Nutrition Day are organized at the village level to provide health checkups, immunization, nutrition education and counseling services for pregnant women and mothers, and they are organized on the monthly basis. Anganwadi also, under the ICDS program, there is a provision of supplementary nutrition, growth monitoring and nutrition counseling for mothers and children. In Poshan Abhiyan, the government aimed at reducing the stunting, undernutrition, anemia and low birth weight. So it encourages better nutrition practices through community participation and awareness activities. This is home-based newborn care and this is home-based care of young child. Under this, the ASHA is the primary health worker which provides multiple home visits to the family where there is a newborn and there is a young child, and there she provides counseling regarding nutrition, breastfeeding and the identification of danger signs in the newborn. In Baby Friendly Hospital Initiative, it encourages hospital to follow the 10 steps of successful breastfeeding. That includes early initiation of breastfeeding, avoiding unnecessary formula feeding.